Robotic has come over the last 3 years probably. It will also help you cut the bones in the correct position.
Wearing high heels can cause back pain.
It can cause a load of things apart from back pain, foot pain, ankle pain, and also a lot of ankle ligament injuries because of high heels.
So that's why they're walking very slowly. Sitting cross-legged on the floor is good for your knees.
It's definitely not bad when you're young.
Does good posture means sitting straight most of the times?
Sitting straight for a long time also can bring a lot of pressure on your discs. Any painkiller is now available on the counter. Some of them even take steroids.
In this episode, I have my friend Dr. Sathish Devadas. He is not only an orthopedic surgeon, he is a family surgeon as well because he has operated on my dad for osteoarthritis and knee replacement.
Shrug them. So this is shoulder shrugging and bracing exercise.
My patients are going to shrug the shoulder and looking at the phone.
People do, they press here, says, yeah, I can feel gas here, and then, they'll belch out through that.
One of my patients came to me and then said, sir, inge kutuga sir. Sir, inge kutuga sir. I just wanted to know what happened to the hero, sir. This is a Gilly climax movie,
Right.
and he is pronating the arm like that. Jasprit Bumrah is better. Hello, sir. Thank you so much for being my podcast.
Good afternoon, Dr. Pal.
Thank you so much.
Thanks for having me here.
I am very thrilled. More than that, you are a very popular orthopedic surgeon in Madurai. But more importantly, you replaced my dad's knee.
Thanks for having the confidence.
Yeah. And he's doing very well. And so then I thought that, okay, so including my dad, he is 71.
Right.
Okay, and I live in the US. And most of the times what we get is that I have knee pain and we are in the US. We say, okay, go and see the doctor. And they recommend something, either medical or surgical. And then if they recommend surgery, parents don't tell to the kids.
That's true.
Even my dad was postponing it for like 10 years, more than 10 years. So I want to ask you, in your practice, delay in seeking medical attention is common?
Extremely common. When I started my practice in 1998, the kind of deformities we saw in these people who had arthritis, it was really grotesque. They'll be completely bow-legged, or it'll be the X kind of legs, and they used to be walking around with them.
So the leg will be like C-shaped?
Completely bow.
Like a bow and oh my God.
Like that, yeah. That's how much of the deformities.
So why does it happen?
See, what happens in arthritis, osteoarthritis, which is a wear and tear of the joints. People get after 50, they can get wear and tear. And because there is an alignment issue in the knee, that is the axis of the knee joint, it falls slightly in the inner side. So there is unequal wear and tear in the knee joint, and so what happens is the inside of the knees tend to wear out more compared to the outside of the knees. So as the first wear and tear is only on the cartilage, so there you won't see much of a difference. But once the cartilage wears out, then it's going to be bone on bone.
Cartilage is the gel between the bones.
No, it's a nice clear coating, which is like a smooth and very, it's a white color. You would have seen when you're eating chicken or something.
Oh, so the white color in the chicken.
End parts of the bone.
So
that's a cartilage. So the cartilage is a very sophisticated tissue which will allow for some cushioning of the joint. It will allow for smooth movements of the joint. So when this cartilage is worn out is where your osteoarthritis comes. And when it is uneven, it can either be in the inside or outside. Most commonly, 95% of the times, it's on the inside of the knee joint. So this is called as a varus deformity, where the bone, the leg kind of bows on the outside.
So people will walk like this?
Yeah, they'll have like a duck-like
duck, they walk
gait.
like a duck.
They'll walk like
Correct.
So they walk like that. And
which means the disease is advanced.
It's very much advanced. So there is a pressure given to the limb when they are walking. So this has gradually, there has been some awareness about joint replacement. Previously, it had bad publicity when one of the prime ministers who had it done, and he didn't walk well after the surgery. But that was due to neurological reasons, not because of the surgery as such. So then it took us a long time for us to educate the public that it's a safe surgery. And still, any surgery for anybody, even for me, I would think at least
Twice.
times before I do the surgery. So it's our duty to educate the patient, the public, that this is a very successful surgery right now. More than 98% success rates are there in joint replacement. So there are a lot of advances happening year on year in joint replacement surgery, like the materials being used, the technology being used, as well as the techniques are getting refined. And we are more wiser now because we have done so many joint replacements over the years. We have seen the entire gamut of the...
Let me ask you, how many joint you might have done?
I would have done around 5,000 now.
5,000?
Yeah. I've started early, 1998, when I finished my MS Orth. So
5,000.
5,000. And I worked in the United Kingdom. So there I started with joint replacements there.
Okay. And the surgery is safe based on my experience with my dad.
Correct.
And you did it robotically on my dad.
Correct.
Robotic is how long? In the last 3-4 years?
Robotic has come over the last 3 years probably. Commercially, it's been available in our country. And it's been available in the other parts of the world, in America and in Germany earlier. But still, it was not still extremely safe those days. But last 3 years, scientific research has shown that it is equally good or better. So first it has to be equally good, then it has to be better. Only then we will use it for the common man.
So I have seen robotic surgeries in gastrointestinal surgeries.
Correct.
And they use this big 3D glasses, Vision Care, Pro Care kind of thing.
That's a virtual reality surgery kind of thing. Yeah, virtual.
That's not the same thing as robotic.
No. So what happens is in a joint replacement, again, like I told you earlier, the limbs get bent. So these limbs have to be put back to the normal alignment, like a car wheel alignment, right? So you have to get your wheel alignment right for that joint to last longer and the patient have pain-free life. So that kind of alignment is what these computer-assisted surgeries helps us. So the next level from computer navigation is robotic. So what robotics does is, it will also help you cut the bones in the correct position. See, joint replacement is not like you are going to take off the joint and put a new joint. It's nothing like you're removing the entire thing and putting. So joint replacement, the knee joint, is just resurfacing the hip knee joint. So you kind of shave off the
Diseased
cartilage,
portion.
cartilage which is worn out and the bone. And then in the correct position, you have to re-implant
the new joint.
A new joint. So that is where the robotics will help you even in shaving it off in a very precise manner. So in human hands and eyes, I can take about a few millimeters here or there. And also, you can also do a few degrees here and there. It can mismatch, say about 5 millimeters. Up to 3 degrees mismatch can occur, which may be significant if you do more than 5 mm or more than 5 degrees, then the alignment goes wrong. And then the longevity of the implant is in danger.
Question.
So
but usually the success rate is pretty good.
Pretty good. It's a very good surgery. The joint replacement for the knee has been done for the last probably 5 or 6 decades. And now with the newer materials, the longevity is good.
And we talked about this briefly where if a patient needs 2 knees, it is, we said, the recommendation was to do 1 knee at a time, if possible.
Yeah. So what happens is there are many young people who have very severe deformities, lesser than 65 or 60 years old. But if they are fitting into the anesthesia protocol where they don't have any comorbidities like diabetes or hypertension or cardiac disease, and if they are not obese, then we can do both in the
Both at the
same
same
sitting.
time, okay.
That will save them more time. It will save them more energy, money, everything together.
Super, sir. Before that, moving on to the next segment, where we really want to understand about arthritis. I read somewhere that it is becoming a silent killer. People think if there is a pain in the knee, it is arthritis. Is that true? Any joint pain in the knee, is there arthritis?
So usually the symptoms of arthritis is first pain. So first is pain. And when is the pain is where the question is. Whether when they are walking, when they are climbing stairs. In our Indian scenario, when women are sitting for cutting vegetables, they're sitting or squatting for toilet. And many of our Indian women like to sit on the floor, and men too when they're going for functions and for temples and for religious purposes. So when these are the things, when it becomes painful, these are the symptoms. So it usually starts with have difficulty in climbing stairs, have difficulty from getting up from toilet. I had to put my hand down on the floor to get up. That's how severe it is.
Oh my God.
And it's pretty difficult for them, and it's so shameful for them to tell that also to anybody.
I have a strong feeling where, introduction of Western toilets in India have increased the rates of constipation.
Right.
Because of the angle of defecation is much better in Indian toilets. Right. Same thing with Indian toilets. When you squat for a long time, in due course of time, the muscles around the knee joint gets better, stronger, because it's a squatting exercise. I have a feeling that, if you keep on using Western toilets, the muscle around the knee joint is getting weaker. Is that a right thing?
I have a slightly different perspective. It may not be only this, because if you see the hip joint arthritis is very common in the Caucasian and white population. However, in Indian population, primary arthritis of the hip is very rare.
Very rare.
It's very rare. Only we get secondary arthritis, which is due to some other reason like fractures, the loss of blood circulation, which is avascular necrosis, or it may be due to post-injury.
Hip replacement.
Hip arthritis.
Arthritis.
Whereas in the knee arthritis, we see it more commonly in Indians compared to the Western population. I would probably think it is because of the squatting. It is because
Is it right?
Yes.
I didn't know that.
I don't have scientific data to prove that. But
it puts extra pressure.
Extra pressure on it. So when they are sitting on the floor, when they are squatting, the pressure of the patella, which is the kneecap, is more on the knee joint. And when they are trying to get up and things or climbing stairs, all these things will increase the chance of knee arthritis. However, hip arthritis, we don't have. So there was a theory that because Indians are squatters, the hip arthritis is less. But probably not scientifically proved. I would think more it's a racial thing, genetic thing.
Very good point. I've been telling all my patients to use Indian toilets as much as possible for the if they have issue of constipation. But I think with this, if you have a knee pain, I think it's better to alternate.
Yes, I guess so. Or you would probably ask them to use a stool. To put their limbs up when they are on the Western.
It's a huge business in India, US.
Yes.
True story. A friend's dad in India, mild pain in the knee, comes to US. We were in Boston before.
Right.
At that time, it's a cold weather. 1 week into the US, severe joint pain. To a point that we need to take him to the ER. And he was still cribbing about the $5,000 bill. Cold weather changes?
Yes. See, there are now two kinds of arthritis. One is, there is what is called as osteoarthritis, which is the degeneration and wear and tear of the knee joint, which is the most common thing. There's another type of arthritis, which is called rheumatoid arthritis, where it's an autoimmune disorder, where the body is going to act against its own parts of your body. Which is the knee joint or any other joints. Rheumatoid arthritis can occur in many joints.
Including small joints.
Yeah, small joints or fingers, common. So what happens in osteoarthritis is when when they go on to very cold temperatures, the muscles, ligaments, they tend to stiffen up much more. So usually people with arthritis, the muscles and ligaments will tend to protect the knee joint or protect the joint by contracting and keeping the joint fairly protected. But then when in cold conditions, when there is the muscles and tendons, ligaments are not able to contract so well because of the cold weather, they tend to stiffen up. So that is one reason probably osteoarthritis, degenerative arthritis, they get pain. Rheumatoid arthritis, it's a well-known fact that rheumatoid arthritis in cold weathers definitely become inflamed in the winters in our country also. Even in Tamil Nadu, we can see in the rainy seasons and cold weather, people will get a flare-up of the rheumatoid arthritis.
Wow. Next question can be controversial. Feel free to not answer if it is okay, if I'm okay with that. I've seen people taking turmeric tablets and also turmeric ointment applying on the for osteoarthritis knee pain. Your take on that?
See, turmeric as such is been scientifically proven that it's an anti-inflammatory. But what is that product inside that which is going to be actively reducing inflammation is what is the curcumin, C3 complex is what is the most potent ingredient. So if you are taking just ordinary turmeric from your local shop and then doing it, you will probably need to eat 1 kilo of turmeric or apply a turmeric bath or whatever. So probably the concentrations are not going to be enough for you to. So it is better to take turmeric and the C3 complex, which can be available in some of the nutraceuticals, which are available.
Any dosage, sir?
Dosage it would be around 5 to 10 milligrams is what I think.
I see.
Scientifically, it has been proven. But it has to be the curcumin C3 complex rather than the entire turmeric. So it does help.
It does help. Even topical when you apply it over the knee as well?
There are some topical applications available, but usually they mix it with either diclofenac or with menthol or other stuff like that. So you have to take it with a pinch of salt.
Sir, when you take diclofenac, the painkiller, let me tell you a story. Nowadays we see arthritis in young men as well.
Correct.
Okay, so this is a 43-year-old IT engineer in Bay Area. I'm going to tell you all my US stories.
Sure.
Because I can't vent out to anybody else.
I can tell you my Indian stories.
So 43-year-old has been having knee pain, likely because of obesity, because of the strain on the knee, has been taking this diclofenac, ibuprofen for painkillers. Because in the US, it's easily available over the counter. He has been taking it for almost 6 months to 1 year. I got called in at 1 a.m. With a patient in the emergency room, which was this patient who was vomiting blood. So I go there, I do the endoscopy. There's a huge ulcer in the stomach, bleeding and bleeding. We spent like 1 hour controlling it. Finally, we did transfer to ICU, stayed for like 2-3 days. Opened up again, couldn't be controlled with endoscopy, went for surgery. We need to remove that portion of the intestine. And it's all because of the painkillers. And you and me know that painkillers does have an increased risk of stomach ulcers. Is in your practice, pain is one of the main thing that you deal with. Do people take painkillers at this much amount of a dosage?
Yeah. So the Indian story is any painkiller is now available on the counter because without prescription you could get anything in pharmacies. So that is a really sad thing. Some of them even take steroids. So that is how bad it is.
Steroids are available easily?
Easily over the counter.
Are you serious?
Yes. So it is a sad thing. But they do come back with severe acid peptic disease and So my recommendation is for young arthritics is not to take painkillers. They would do well with other physical therapy. Physiotherapy is something which you should do because it doesn't have side effects, and also to strengthen your muscles and do some lot of activities, exercises. So these kind of things is what youngsters should do. And then probably take some nutraceuticals. Yes, in the acute phase, they may take painkillers, but it should be under the supervision of a doctor.
Not for a long time.
Correct.
Not for a long time. Will paracetamol help in pain?
Extremely good. Paracetamol, our local brand, which is 600,
Dolo 650. I can say
I
that.
don't
You
want to
cannot
say.
say that. I can say that.
is extremely good, and that should be the first choice for, especially for elder individuals, because it's much safer on the stomach, safer on the kidneys, and reduces load on the heart. So that is much better for elder individuals.
So many people have asked me what is the safe dose of paracetamol. So what I say is, based on the liver literature, 4 grams per day is okay. 650 milligrams is your Dolo 650.
Correct.
Okay, so that will be coming around like 4 to 5 tablets a day. So no, I'm sorry, even more.
Much more.
That's why I chose medicine.
So what, for being a safe practice, we do it as 2 grams.
2 grams per day.
Because in elderly individuals and people who are Indians who are very low weight, people less than 50 kilos, you see a lot of these old ladies who are very thin. And so for safer side, we usually give it at higher doses. 2 grams.
2 grams.
So 650 milligrams thrice a day should be more than sufficient to control their pain. The initial stages, in the acute stages only. So again, I would emphasize physiotherapy and exercise.
Exercises. Super, sir. So that brings us to the next question in terms of why does all this arthritis is happening at such a young age, like 35, 40, when we used to see only like 50, 60?
One thing is, first we should know that our life expectancy has gone up. Tamil Nadu is about 75 years. In those days, when you are cross 40, people say you're an elder person. And when somebody passes away by 60, then he has lived his life. But not
correct.
today. Today it is about people live more than 90s, 100s, easily because of the medications. And it's going to get even higher nowadays in future. So, and second thing is, the activity levels of people has come down drastically. So most of them have a sedentary lifestyle. So they move only when they need to, which is very less. Most of the time it's in the cars or two-wheelers, or there is no activity for these people. So muscles and everything become completely wasted.
So muscle needs stimulation.
The muscle needs stimulation. So for both, one to protect your joint and to protect your bones. So only when your muscles are working Wolff's law, you will get the bones will become stronger, especially more in women. That's why we say women who tend to get osteoporosis, they should do exercises at a younger age.
What age will you say?
I say the bone is a bank for these girls, and they should start in the second decade of their life. And after 30, 35, the bone gets weaned off.
So women should start working out between 10 to 20 years of age.
Yes, 10 to 20, they should start their exercises and more of resistance exercises. So that will, the bone will give resistance to these exercises, and that will make it more stronger. So that is very important. They need to take good diet as well as exercises during the second and third decades of their life.
Moving on, the biggest problem is neck pain. And there is a term called text neck.
Yeah.
Can you tell us about it?
A lot of these young people, they are probably spending 7 or 8 hours on their cell phones. So this is a text neck is probably what they started because they were texting those days. Now they are flipping their Instagrams with their fingers.
It's scroll neck.
Scroll neck. So we call it cell neck nowadays.
Cell neck.
Cell neck. So what happens is when they are sitting and with their necks down and looking for hours together, it's like 25 kilos of weight is put on your head. and that's the kind of strain which happens on the neck joints, on the neck muscles. So it is extremely debilitating, and so it is not good for young people to do this. And we saw it a lot during COVID time, and people had nothing else to do than just scroll on their phones. So
can you tell a patient experience, like a patient comes to you?
This happens in very young girls in their college studies.
Like 2021?
2021. And of course, any neck pain has also got a little bit of psychosomatic, which is stress related. So this always looking into the cell phone, and then during exam times, there is an increase of this pain. Typically, they don't have much of symptoms per se except pain. You cannot elicit any big problems in that from the X-ray or the scans or anything.
So X-ray will be mostly normal?
X-ray will be mostly normal. So only changing their posture. So the simple thing is to keep your phone hand on the armrest, keep the phone on your eye level. So that would be a simple thing to do. I did a reel which went very viral during COVID time about this work from home. So what happened is people were working from home. They didn't have proper tables or chair. They used to lie down on their beds and on their laptops they would work. They would put the laptop on the floor, lie on the tummies and work from the. So all this led to a lot of neck pain during COVID time. So I had taught a couple of simple exercises which went
Can you tell us, sir? Can you tell us?
So it's very simple. You need to strengthen your trapezius muscles. So you just keep your arm at the level of your chest, and then just take it behind. So you can feel the trapezius muscle stretching there behind. So this is one, and another one is just hold your hands together and shrug them up. And shrug them up. So this is a shoulder shrugging and bracing exercise. If somebody is working and they're having neck pain, every hour if they can do 10 of this and 10 of that, which will probably take 20 seconds of the time, it's really going to help them to stay away from neck pain.
My patients are going to shrug the shoulder and looking at the phone. But that helps, no?
Definitely helps. It's an extremely useful exercise, and people, even with cervical spondylosis, people, if they do this, they can stay away from pain.
How often, sir? You said, I forgot.
Every hour, 10 times.
Every hour, 10 times.
Even you can do it while watching TV, you can do it in between cutting vegetables, or even between your office, or in between teachers. Teachers tend to get this more often because they'll be writing on the board. They'll be sitting like this and ticking. So all those things. Teachers also, between classes, they do. All this thing will definitely help.
So while I was doing orthopedic rotations over there, at that time they were talking about all this, and then there was a mild intervention that they did for all the residents and the students in the orthopedic. That if you have to use your phone and walking, so while you're walking, it cannot be like this.
Right.
So it needs to be like this. So people were walking like this.
And hitting against each other.
No, they didn't hit that much because they were able to see.
See at least.
They were hitting each other only when they were doing it. So you're saying that when you lift it like this, the pressure actually goes off.
Definitely releases.
Wow.
Because all the muscles in your neck are contracting in the front, and that is getting stretched at the back. And there is a disc between each and every bone, which is like a shock absorber. So the stress on the disc is going to be much more in a flexed position when it is much. So this can lead to arthritis at a later stage, cervical spondylosis at a later stage.
Just out of curiosity, I'm asking. So let's say you have a patient with cervical spondylosis with a neck pain, with a later degenerative days. Okay. Have you gone back and asked them, hey, have you used your
probably the generation was different. When the people in their 40s or 50s probably come to me with neck pain. But still, I could relate it to the kind of jobs they do. Like I said,
teacher, correct. If you can relate that, then I think we are just a decade away from this booming cases of neck pain. Wow. Oh my God. Okay. All right. So if you have neck pain, what is the best sleeping position?
So the best pillow for your neck is your hand. So that's the best one. And you don't use very thick pillows. Now there are commercially available pillows, that contoured pillows and things like that. May not be necessary. You can just have a thin pillow. You can. It's very difficult for people to sleep in only one position. So you can sleep on the side as well as. That's not going to increase your neck pain. Just that should not be very thick pillow. Some people say I need 3 pillows to sleep.
Correct.
No. You should have a thinner pillow, single thinner pillow. Sometimes when people with severe neck pain, I would recommend them not to use a pillow. Just roll up a small sheet or sari or something and put it behind the neck.
So the angle is lower.
Correct, angle is lower, and that will also relax the muscles, because many times muscles get very tight when they are having.
So sleeping on your tummy, does that increase the neck pain?
No, usually it doesn't.
Because that is...
There's no bearing to that.
Back pain?
Back pain also you can sleep however you want. The only thing is sitting for long is what causes long.
The reason I'm asking is I sleep on the...
No, doesn't have any back.
That's very bad. So, your hospital, Devdas Hospital, has been there for a long time in Madurai. And it's pretty popular. My house is right next to you. And one thing I'm really admire your hospital is that your handling of road traffic accidents. Trauma center.
Correct.
You're a big trauma center where people from all over the place, in and around Madurai, will come to you through ambulance, correct?
Right, through ambulance.
So, we were really thinking, okay, so what should happen in the first 60 minutes of a road traffic accident?
So that is what we call as a golden hour.
Golden hour.
Okay, so first 60 minutes is a golden hour where life can be saved. So what happens in accidents is there can be blood loss, there can be breathing problems, there can be consciousness lost in accidents due to head injuries and things. So these are the things in the first 1 hour. If we can make sure that we stop the bleeding, make sure the person who's injured is breathing, and make sure they are painless, I think this will go a long way in saving lives. Unfortunately, many times the first 1 hour is usually lost at the field. But thanks to the government's initiatives, this 108 ambulance. So this ambulance now has a trained trauma technician along with the ambulance. So they go to the site and they have these spine boards. They have these things to stop bleeding. And if they need to be, given breathing, if they are not breathing, they can even do artificial respiration with their ambu bags and even tube them if they require.
What an important intervention, right?
It's extremely good. And nowadays, we do see the ambulance bringing these patients. They're doing an excellent job. So more lives are now being saved. And my only this thing is now with all this 4-laning and the people need to cut down on their speeds. Rules have to be stricter because 4-lane people come on the other side, on the wrong side, and these things if they do, then we can eliminate more accidents and definitely save more lives.
We were driving from Chennai to Madurai,
Right.
And then we were going in the car, and then the car was beeping. I said, why is the car beeping? It's because we are going at 140 kilometers per hour. Then why shouldn't it beep? Because if it goes beyond 120, it will beep.
Yeah.
Okay, then, don't go.
So the government has definitely given 140 kilometers and all. It's very difficult to control the car if somebody comes in. In our country, cows can come in between, people can go in between. So it's very difficult to control the vehicle, to put the brakes and things like that. So it's not safe to go at that speed. And definitely government has given a good mandate. That it's 120 seems to be high.
Seems to be high, huh? Can you tell from your experience a very traumatic case that you might have seen?
Very recently, there was a young girl, 12-year-old. She was going to school, and unfortunately, she's near Karaikudi, and she was hit by a car, and kind of it ran over both her legs.
Oh my God.
A young 12-year-old girl, pretty girl. And poor thing, the parents brought to us in about 3 hours because it takes so much time to come from there to Madurai. And we had to resuscitate her. We had to make sure so much of blood and things were given. And the parents were very supportive, and she had to undergo at least about 12 surgical procedures because both the limbs were crushed totally, orthopedic, plastic surgery, vascular surgery, because one leg, the left leg, didn't have blood supply also. So we had to repair the blood vessel, and that was the first surgery. And then many surgeries, and right now she's going back to school. It's a very happy moment to see her coming now, walking now without any supports and things like that.
Is that prosthetics, sir?
No prosthetics.
No prosthetics.
We have saved both her limbs. Wow. So she's able to walk, she's able to bend the knees.
Wow.
And so she's doing very well now. And here I want to say how the community also supported. They were not from a very good background. So financially, so they had to get financial support from people, and a lot of organizations came, and because she needed many surgeries, medicines, and all expensive. So many organizations came, and we had also put her up for crowdfunding. And crowdfunding, it was like it was a young girl with two limb lost, two limb crushed. It was a very good thing. The people, money started pouring in. We had to say stop. We don't need this much. So it was anyway. It was
a nice, satisfying experience.
Satisfying, and at the end, because she's now going back to school and she's doing all her activities what she had to do.
Could have been prevented with the initial speeding thing.
I think it was rash driving.
Rash driving.
So she was standing to go to school.
Oh my God. Sir, how about alcohol driving, sir? You get cases like that?
I would say it has come down. Probably because police are tracking them and doing it. It was quite a bit 10 years back. But nowadays, the maximum number of accidents we see are due to stray dogs. Stray dogs coming in between, trying to bite them, and the two-wheelers, they just skid off the road, and that is now nearly 30-40% of my accident cases.
Wow.
So that is a menace now, rather than alcohol.
That's an alcohol. Alcohol is a menace for me, my patients. Sir, if a leg is crushed, a surgery is necessary, not necessary?
So there are two types of fractures. One is a closed fracture where there is no, the bone does not communicate with the environment. And then there is an open fracture where there is blood coming and the bone is, the fracture is directly in touch with the environment. So there is infection going to happen.
Then surgery is needed.
Then surgery is needed, and then they may need plastic surgery and things like that. So when fractures need surgery is we see a lot of patients in rural areas, not even rural, even Chennai, they go to Puthur Kattu and get surgery, treatment there. So where surgery is required and where you can manage with plaster or this cut is like mainly where the joint fracture is there, 100% you need to restore the joint to the normal anatomy. Then you will, that requires surgery. So any person with around the knee joint, around the hip joint, around the wrist joint, elbow, shoulder, all these areas, you will definitely need surgery. Where, especially forearm, people think forearm fractures, they don't need surgery. But forearm has got a very big movement of this. If the surgery is not done properly, if the bone doesn't unite properly, they cannot take food to eat. Because you need to do this and
then turn
and move. So it's extremely.
Sir, I saw a case where they went for this Puthur Kattu on the forearm thing, and the union was not proper.
Correct. Exactly. It's called malunion. So this is what happens, and the movement is restricted. And for young people on a right hand, somebody who is a breadwinner of the family, if he can't work, so say an electrician or a plumber.
So you were saying that, okay, so Puthur Kattu, people are still liking it, But they have to determine whether the joint is involved.
Correct. So the joint, if the joint is
They
involved,
take X-rays?
nowadays I believe they do, but not everywhere.
Not everywhere.
This is only in Puthur now, but I hear around in rural areas and all, there's a lot of people who just go and put this. So they have this muttapattu, and they put egg white and they put a plaster.
Is it right?
Yeah.
How do they do it? Egg white on
Egg white solidifies, so it becomes like a plaster of Paris.
Is that right?
With just some muslin and egg white. They put a few sticks to make it a splint.
Splint, Egg white bandage.
Egg whites.
Who is your favorite actor, Ajit or Vijay?
Oh my goodness. Should I be politically correct?
Politically correct means then definitely Ajit.
Yeah, probably Ajit. Yes.
Ajit, okay. So this is a reel of your favorite hero.
Racing
incident. This was so widely seen, and also I was like so scared. I also like him a lot, and I said, "Wow, what's happening? What happens sir, in this racing incident?"
So the racing incidents, you're dealing with high velocity and then high deceleration. So this is what the major issue is. So when it's all of a sudden, when you're going from 200 or 250 kilometers per hour speed to suddenly stopping with some movements, say here we saw him spinning. All right. So ideally, these race cars are very well, the drivers are very well protected because they have very good seat belts. It's not like our regular seat
Simple
belts.
seat belt.
It'll be like on both sides as well as a lap belt. So it'll support both the shoulders as well as, and of course all their rear bags, and they'll be wearing helmets. So the main problem is there's acceleration, deceleration. So when you go forward and then go back, it's like a whiplash, like your chatai, which goes snap, comes back. So there may not be any bone injury, but then the spinal cord can get injured there.
So it's called a whiplash injury.
Whiplash injury.
So it's like a whip. You put it, you come it back.
Yeah.
So same way you just go back and then come
go back. And then it all happens in fractions of seconds. So
the spine will not be able to handle that.
Spine may not be able to handle that velocity and that movement. So there spinal cord injuries can occur. So it's very important for handlers there as well as people to first support the neck. Make sure, just they don't bundle them up in an auto rickshaw and send them to the hospital. So the first thing they should need to put them on what is called as a spine board. Spine board is something which will keep the spine very stable. It's a very hard board, that's all. And the second thing is you need to immobilize the neck with the collar.
With the collar.
Yeah. They have some hard collars which these immediate responders will do.
So the 108 people will do this.
They will have these spine boards and collars. And they have these spine boards will be like a scoop kind of a stretcher. It will not, you need not take the patient up and you just scoop it from. You can split in between and scoop and
yes. So there will be two boards.
Two boards. Or it will be hinged on one side.
Hinged on one side. Correct. I see in that.
So this scoop stretcher is very good, and spine board with the spine immobilization. And if you want to turn this patient who is injured, you should roll them like a log. Keep the neck, the spine, and the legs all in the same rotation. So you need 3 people to turn the patient.
It's a very important point.
So that's called the log rolling. So if you just turn only the body, like the neck, then you are further trying to damage the neck. The head will be like this, body will turn and you can damage. Similarly, for any spine injuries, it can worsen the spinal cord injuries. So it's very important for these high velocity injuries to log roll these people both in the primary and the secondary settings.
This is a race car injury, but in your practice, have you seen this kind of injury in your daily practice?
Nowadays, like you said, your driver would go 140 kilometers per hour.
That can happen as well?
It can happen to anybody, and suddenly if somebody comes in between, you're not even as protected as a race car driver. As Ajit Kumar.
So you have seen that?
Yeah, we see it
almost
very often. Very often. So it's not uncommon at all.
Sir, again, we know all seat belt is very important.
Correct.
Okay, and seat belt is not that important when you are just driving at 20, 30 kilometers an hour. No?
No. No. At any given time, I think seat belt is definitely important.
I mean, in
In
US,
both the front and back.
front and back. In the US, we wear it because if not, they will
It's
ticket
fine.
us and we'll pay fine. But usually it's high velocity.
Yes.
It will protect you.
It definitely.
Okay. So the idea is that, okay, so there'll be car airbags and then seat belt so that it doesn't hit you that much.
Correct.
In your experience, where a seat belt has not been used and the damage has been bad?
Extremely. I've seen one gentleman who was a very young man. He didn't use the seat belt, and he had there are 10 ribs or 12 ribs on each side, and he had fractures of nearly 22 ribs because of that.
My God.
And he also had a spine fracture, which made him a paraplegic.
So he cannot walk.
He cannot walk. And it
Bathroom as well. He cannot control
he
his
can't control
his bowel. He will
bowels
leak
and,
bowel, urine.
Exactly. So these are very important things. You should definitely wear a seat belt. Some people say seat belt injuries are there. Yes, it was there earlier, but
Not
now
anymore.
not anymore. Seat belt injuries when there's only a lap belt. So that time you used to get that. Nowadays with these modern seat belt injuries are very rare.
So similarly, nowadays everybody is starting to wear a helmet as well because of fine as well over here. Any patient scenario where a patient did not wear a helmet and what could happen?
So when patient is not wearing helmet, when usually in a two-wheeler accident, the person behind, the pillion rider, will be thrown up. So it's very important the pillion rider also wears, because this guy will be at least holding the bike handle and he'll fall on the floor and hit his head on the floor. But this person will be flown up in the air, make one or two somersaults and land on the platform or anything right on the stone. So very important, both of them wear helmets. And head injury is really debilitating, because it's usually these young people who are breadwinners of the family. It becomes a social burden, because first they are not able to earn for the next 4 or 5 months, even if they are on treatment. If there is any residual problem, they become a burden on the family for the entire life.
So this is an accident scene. Okay. I wanted to ask from an orthopedic surgeon in terms of, okay, so what could have been done differently?
ரொம்ப தேங்க்ஸ் சார். நல்ல வேளை உங்கள மாதிரி
So
ஆளுங்க
this is a guy who is on the ground and our onion Vikram is...
பாத்தியா?
And somebody want to help and then he left.
Right.
சார்
Here I would definitely say ambulance has to be called first. So before the ambulance comes, you would have seen another movie where Vikram will be resuscitating a person, will be doing CPR. So that is the most important thing. I would recommend everybody to learn CPR. At Devdas Hospital, we have made it a social issue that we have now trained about 75,000 people CPR training.
Oh, nice.
So we take them to colleges, schools, police personnel, or wherever there are big groups, and we train them with the mannequins and teach them how to do CPR. So we've done around 75,000. My target is 2 lakhs. So at least somebody can be saved by these things.
I have seen, I've been in the US for like 16, 18 years now, but when I was here, people who are usually bystanders or a lot more, right? They don't come in because they're scared. What, it will be a police case? Or what if the blood comes on us? And then, what will you say to them?
So now people need not be worried, because there is a good Samaritan law right now. So if you are helping somebody who's injured in an accident, the law says that you will not be included in their in the first information report, or the police will not call you and harass.
Oh,
all these things.
nice.
So people can be rest assured. Second thing is, it is a life, and it is somebody like you who is suffering, who is also having his families, parents, children. So it is, do not see such things like blood and don't get this thing. Bystanders should definitely help. But not like everybody should jump in, and so at least somebody who knows CPR. So one person should go call for help, call ambulance, And then till the ambulance comes, like I told you, the patient should be kept flat on the ground. And and done CPR. Don't bundle them like what he was doing and throwing them into an auto rickshaw and taking it. This can cause neck
Severe
and back
damage.
pains.
That's a good point. As a matter of fact, Onion was released in 2005. And 108 was introduced in 2008.
Oh, right. Okay.
I'm not sure because of the movie. But okay. One more.
Right.
So this is a famous song. You might know this. Okay. I just want to know what happened to the hero, sir. Why is he walking like that?
I guess it's his mannerism rather than or he must have had some injury during his smuggling days. He's had, so these are only two things I can think of why he's doing that. And
what can happen?
His lover seems to be impressed with that. So no harm.
What can happen medically to cause that?
The two things what I could say is, one is it can be a congenital problem. There is
he's born with that.
Yeah, he's born with that. There's something called as a sprinkled shoulder, where there's the whole thing is contracted and he can probably get lifted up.
You've seen patients?
Yes, yes, a lot of young people with sprinkled shoulder. We kind of do surgeries to bring the scapula, that's bone down, and make sure they're at least cosmetically much better.
So this guy is not that because the next movie he's okay.
So it's mostly a mannerism.
Second reason, any neurological problem?
Neurological problems, there can be. See, like I told you, there's a trapezius muscle is supplied by a couple of nerves here. If one side the nerve is not working, they can have a drooping shoulder. Drooping shoulder, not a lifting shoulder. But the other side could be drooping rather than that.
So that happens of trauma, no?
It can be due to trauma, it can be due to some surgery, or it can be some tumors. So that can happen. But very funnily, people, they believe, funny incident is that people believe that now that you are also there, people feel that they have gas all around their body. And the pain in the back, or say, I ate potatoes, this gas is trapped there. So, as a gastroenterologist, can I ask you, is there any connection between the gut and the muscles?
Gut and the skin.
Skin, yes.
Is there.
How is that?
Okay, it's gut-skin axis.
Okay.
Similar to brain-gut axis, we have a...
It's a neurological thing. It's not a physical thing.
Not a physical connection. Not a physical connection. And then
So what people do, they press here, says, yeah, I can feel gas here. And then, they'll belch out through that. So we need to tell them that there is no connection between your gut and...
One of my patients came to me and then said, sir, inge kuthunga sir. Sir, inge kuthunga sir. Yenda ene pathonu eppura irukku. So the reason, that's a very common problem.
Yeah, it is.
That is not because, the gas is being trapped. That's because of hypersensitivity. Hypersensitivity. And the whole brain-gut axis is very, very sensitive. That, even if you had healthy food, they will have the problem.
Correct.
But it is just a mind thing that, okay, so this is going to get better.
Why?
Sir, so one more, sir.
Yes, please. I'm all yours.
So we spoke about Ajit, na? So if I don't speak about Vijay,
It's
then
not
it's a
politically correct.
Deva Kutam. It's a Deva Kutam. So this is a Gilly climax movie.
Right.
And he is pronating the arm like that. And Talaivar is like, look at that. And he's generating force. He's going to bowl. Even Jasprit Bumrah is better.
Main problem here, before this scene probably, they will say they'll give you Varma.
Yeah.
And he will press something in the nerve and then the limb becomes paralyzed.
Correct.
That's what the movie and the Varma Kalai, they say.
Yes, in Indian.
Yeah. So I'm not sure if we knew that scientifically, then we could cure a lot of things. But probably it is there. It was a science those
behind.
days. But what I can probably think is he must have had a dislocation of the shoulder, which he's probably reduced it himself. A lot of people with the shoulder dislocation, especially kabaddi players, they have a lot of sports injuries. So they will just push back their shoulder inside and then. It's been well dramatized.
But that is a common phenomenon, right?
It is. Shoulder dislocations, the recurrent shoulder dislocations, a very common sports injury with bowlers. Probably in the US, you'll have a lot of these throwers from baseball.
Baseball, correct.
And, of course, American football.
Yes. I had a baseball friend, who plays baseball. When he throws, second
It comes
throw, it comes back. And then he just fixes it and then he pushes it. And then one day he was not able to. And he asked my help.
Right.
Because they thought I'm the doctor. I said, hey, I'm a gastro doctor. So then I have done that in my medical school.
Right.
So I know that, okay, so it's not going to cause any problem. So I actually fixed it with a lot of anxiety. But I was able to get it right. He said, don't worry, doctor, this happens to me all the time. Can this be fixed surgically?
Yes. So here what happens in a recurrent dislocation, that is when the shoulder dislocates more than 2 times. We call it as a recurrent dislocation of shoulder. Commonly in sports people. Now in accidents also it can happen. The shoulder is a ball and socket joint. So what happens is there is a nice tissue called as a labrum which is attaching onto the front of the socket, which is the cup. So when the dislocation occurs, this tissue tears. So the head tends to come out through that. So that is the reason for recurrent dislocation.
I see.
So stitching this tissue back into the bone, now it is done through arthroscopy. So it is very simple surgery. We just 3 small holes. We have very specialized instruments and specialized screws. The screw will have a suture. Which we can do from outside. So that is extremely successful surgery.
Oh, beautiful.
And these people can be rehabilitated well,
very well, super
after surgery.
So in these recurrent arthritis, so do you recommend, especially for osteoarthritis of the knees? I think I have asked you this question when I was in the US.
Right.
Can I prescribe chondroitin and glucosamine tablets?
Correct.
It is being sold like crazy in the US market. Any data to it?
Yeah. See, glucosamine and chondroitin, like I told you earlier, cartilage is the main part of the knee joint, which is getting worn out. So in the early stages, glucosamine and chondroitin are the building blocks of the cartilage.
I see.
So it is definitely will help you. Research shows that it can help early arthritis and also it will prevent degeneration for probably 2 to 3 years maximum. After that, it becomes redundant. And in people with very severe arthritis, you will probably not
get that much amount of benefit. That's what you told me, because my dad's disease was advanced. You said it may not help that much.
Correct.
Maybe you can use it as a placebo.
Right. So there are a lot of now newer treatments for arthritis. Like now in very young people, as you said, who have this varus deformity, that bowing of the legs. And we know that surely they're going to go for
surgery.
Heavier. Later on in life. So we can cut the bone and straighten it. So that way the deformity is corrected. Similarly, the arthritis progression is stopped. So that is one thing. The second thing is sometimes when the one side of the knee is only worn out and it's causing severe disability for this person, then we can only that side of the knee we can replace, which is called as unicondylar knee replacement or uni-knee replacement. So this will give them another 15-20 years of life, and then they may proceed to do for a total knee replacement. So these are some advances. And of course, some injections have been available. Like this platelet-rich plasma.
PRP.
And stem cell therapy. Stem cell therapy till date is not scientifically proved.
Clinically proven.
So I think even in your people will be doing that, and it's not scientifically proved yet.
So they do that in India?
Yeah, PRP is being done. PRP is approved by FDA, and a lot of studies have shown that it's as good as steroid injection or better. And because it is not a chemical, it's a patient's own blood, so it is safer also.
So tell me whether I understood this right. So you take the blood of the patient, you centrifuge it,
Yes.
you take the plasma part of the blood,
Yeah.
which is the lighter part, and then you put in a bag, and then you infuse into the knee. You do arthroscopy.
Yeah, no, it's just hardly 3 or 4 ml will be there, because we take about 15 to 20 ml of blood only, and centrifuge it, and there is a buffy coat on the top, which we can, with some special canisters, it will separate it only, and that part only 3 ml.
3 ml.
So we just inject it into the knee.
It's an OP procedure.
It's a OP 20-minute procedure.
20-minute procedure. And some patients do get better.
They do definitely.
Definitely
It's
better.
usually a 2-dose, 3-month gap.
3-month gap.
And a lot of people, they don't come back at all with arthritis.
PRP is everywhere, sir. PRP, hair, skin.
I know. Gut also, I guess.
Eventually. So, I'll tell you the biggest problem with supplements is that, this contracting glucosamine, I didn't know where to buy, what to do. So I'm glad that you are actually venturing into the entrepreneur role as well.
Right.
By having this huge website called Cureka, huh?
Correct.
And you're having all these medical supplies. You showed me. I was like, wow, what are you doing? You're so busy and you were able to do this as well.
Yeah.
I think your wife takes care of it.
Yeah, my wife, Dr. Hema, and me, she's a dermatologist and I'm an orthopedic surgeon. And we get patients from far and wide, from probably outside the country, from around Madurai. And so by 2015 or something, we realized these people need to consult us to get these things back. So we started this website 2014, sorry. So that's the first
What's
we
it called?
started.
Cureka.
Cureka.
Like Eureka.
Yeah, Eureka, we cure. So we started this, and we were making these kind of over-the-counter products available for them. Anything from a nebulizer to a wheelchair to a walking stick to milk powders to everything we started doing. We were a little ahead of our time, 2014.
Correct.
Then we realized after COVID that this could be a wonderful venture. And then only we thought it really helps people, because we can kind of send these kind of products to people in the Northeast who cannot get good medical supplies and advice. So we started another app called as a Second Opinion. So I was telling that so the patients come from far and wide, and for them we need to give some advice. And people now, we could reach them even to the corners of the country. Outside the country, my patients were sitting in the US, sitting in this thing. So all these people, they have some doubts. So we started this app called Second Opinion. Again, during COVID, we had a lot of
course,
during the telemedicine. So now it is integrated with our Cureka website. So people who say, okay, I have this problem, doctor, can I use this product? So we give them that advice also. What size of the product should I use? Like a DVT stockings for varicose veins. So all these things we give them advice on that. So it's doing extremely well. We are very happy that we are able to help people as well as being an entrepreneur.
Of course, sir.
Yes.
Of course.
And we also now we brought out our own private label brands. We manufacture nutraceuticals. So we manufacture gummies. So we bring your glucosamine and all these things, and people can take it in a fun way. It's not like you need to take it as a medicine. So it tastes good. It's sugar free. Anybody can take that, and it's like you can just pop in 1 or 2 gummies a day. We have multivitamins. We have sleep gummies. We have hair health gummies, and very importantly, we have a women health gummy for postmenopausal women.
Nice.
So that will have soya isoflavins, vitamin D, calcium, and all those things. So that really helps in the perimenopausal women also, because we have added a little bit of herbal stuff into it, like this black cohosh, American ginseng. So all these hot flushes where they have, all that get rectified during that when you're taking this. So there also we are into that now. And my wife, being a dermatologist, she has manufactured her own skin line of products called as the Good Hygiene Company. It's a completely organic, plant-based skin products. You could even eat the cream. So that's how much it is so safe. And there is no chemical at all. 99.9% no chemical.
Is she taking care of your skincare?
A little bit, yes. I'm the guinea pig, though, for her research.
So moving on to the next segment,
Please.
Okay. So here, some general myths that we asked our subscribers here, what is a myth that you think that we can clarify with the very popular orthopedic surgeon? So number one, cracking knuckles like this causes arthritis.
So cracking, people do it in many different ways. Sometimes a neck they will do, like in a movie or something, they will do that, and the villain will come like that. Second thing is cracking knuckles. Cracking knuckles, parents will say, don't do that, you're going to get arthritis. Not like that. Neck, I agree. Probably if they try to do something very severe to get a crack, then you may damage your neck joints. But usually fingers, toes and all, this is just some trapped nitrogen and gas which is escaping when you are doing that kind of a movement. So it's not going to cause arthritis. A lot of MRI studies have been done, dynamic MRIs, to show that you are not causing any damage to your fingers.
Sir, question on the neck thing. I see in many gym, after the workout is done, they have the client on the back.
On the stomach.
And on the stomach, yeah. And then they have the head on the side. And then they punch on the back. And then we are hearing the cracking sound. Dangerous, yes, no?
If they don't do very severe movements, sudden movements, like in the barber shop, they will do tuck. That is dangerous. I've seen one person with a...
So, moving the neck in a barber shop is dangerous?
Yes. I've seen one person who had paralysis because of that.
What do you mean? You cannot move the legs?
Yes, he became weak suddenly. Suddenly he kind of became weak because the spinal cord got injured. So do not let your barber
But that's
do
a
that.
common practice, correct?
It is common.
This
happened in Kutralam, when they have this oil bath and they do all this. This person had a spinal cord injury. So don't let them do
Can that be reversed, sir?
Because he came early, we kind of did something and medicines and some surgery.
Surgical intervention. But most of the time it is very complicated, correct?
It's very complicated. Why should you go through such thing for just cracking your neck?
Of course. Yeah, wow. So number two, drinking more milk means strong bones and preventing fractures.
Milk is an excellent source of calcium. It's definitely good. I would in a public forum, I would say definitely milking will prevent fractures.
I'll support you, sir.
Yes.
I
Thank
also.
you. So especially in women, like we talked about osteoporosis earlier, they should have milk. Many people, they say, I have tea. Why should I have? But in tea or coffee, the milk added will be hardly anything. Very minimal, just to give that color. So it's not going to really help. I think they should have more milk. Some diabetics will say, if I have milk, I have issues. Then take half milk, half water. Something
So
like
in your practice, you recommend
I
milk?
recommend milk.
Super, sir. Okay. Once a bone breaks, it will always remain weak.
Not so. Apart from the liver, the bone is the only organ in the body which will heal without a scar. Even the liver, after sometimes it gives up. It will become scarified, it becomes cirrhosis and things like that. But bone is only organ in the body. There is no scar after it breaks. So what happens when there's a fracture, there's a natural process of inflammation. The new bone is being laid out, and then eventually there's something called as remodeling. So the bone remodels to what your demands are, what you want. If you want to run, it'll remodel to that way. If you want to stand straight, it'll remodel straight. So it's a
But how do
wonderful
we teach
organ.
the bone?
So the way we teach or we make sure that it remodels well is, so first thing is surgery is required when in the joints, and make sure if you are splinting it with plaster or something, make sure it is done the right way. Do not have any angulations or rotations. So these are things. So this is what probably the Puthur fellows learnt, and they have become successful.
If a child's leg appears slightly bowed, they will stay that way all the time.
So physiological bowing is something which happens in children. I've seen many children who have bowed legs. So till the age of 8 years, you need not worry. They can get back to their normal growth pattern, and the limbs can become straighter till the age of 8 years. But if you think it is because of rickets, if other conditions for rickets would be thinning of hair, they can have a barrel chest kind of things.
So rickets is vitamin D.
Vitamin D deficiency.
Do you see that now, sir?
Still, there are some people, right? Yes, in the lower strata.
How do they come, sir? Bow legs?
Bow legs will be there. So there are some other forms of rickets, where it's called as renal rickets.
Renal rickets.
Yeah, where,
kidney.
Where there is some issue in the kidney. Which prevents the vitamin D, because vitamin D is metabolized in the kidney only. So that is not there. So there they can get this similar condition. So we see more of renal rickets now. So it's a metabolic disorder rather than a nutritional disorder nowadays. But if you see today, if you take vitamin D for anybody sitting here, you will see we are all deficient for vitamin D. So the main thing is lifestyle. We don't go into the sun. Vitamin D synthesis happens in the skin also. So sun is required. And children, nutrition, milk and other products, greens. Children nowadays are eating more of junk food. They are losing out on vitamin D3 and sitting in front of the phones and playing.
So mushrooms are the big source of vitamin D.
Mushroom, yes.
You have to keep it in the sun.
The mushrooms?
Okay. So it will increase
it
oxidizes. Bioavailability.
Oh, really? I didn't know that.
We used to do that in the US.
Okay.
And for my kids.
Okay.
But I will not eat it. They will not eat. So next question is about vitamin D.
Right.
If you take vitamin D daily, your bones are really strong.
See, the natural source of vitamin D is more than sufficient to keep your bones strong. You need not take supplements. Supplements are required only when there is some gut issues where the gut is not absorbing your calcium and vitamin D3 well. So that is what you need to take supplements. But on a normal basis, I think a healthy diet is more than sufficient. Probably people, post-menopausal women or people with gut issues, they may need to take supplements.
I recommend checking for vitamin D at least once a year.
Yes.
Especially in Indian community.
Definitely. I would say that also.
More importantly, post-menopausal women.
Post-menopausal, it's mandatory. For even the younger tech people, tech IT people who are sitting in the chairs for hours together, I would definitely recommend once a year.
So in the endocrinology podcast, we said to check A1C once a year.
Okay.
We'll also add vitamin D to it.
Vitamin D.
Okay.
And for postmenopausal women, do a bone mineral density also once a year.
Sir, please educate us why DEXA scan is very important for postmenopausal women.
See, the statistics say that 1 in 2 women can get osteoporosis. So that is really alarming. So postmenopausal women can get osteoporosis. So every other woman is osteoporotic. So
we're talking about 50 plus?
50 plus. And the symptom of osteoporosis is not there till you break a bone. So the first symptom is a broken bone.
So you will not feel
It's a silent killer. It's a true silent killer. You will not know that you have osteoporosis till you break a bone. But why do you want to wait till that time? Why do you want to undergo pain? Why do you want to undergo so much of treatments and things like that? So for that, prevention is always better than cure. So it's always a DEXA. It's a dual energy X-ray absorptiometry. It's a very good tool to measure the quality density of your bone, the bone density. So that will give a prediction whether you need any treatment for osteoporosis or not. And there are now very many treatments which are available.
Medically as well.
Medically, once a year treatments, once a month.
Either it could do IV infusions or oral tablet.
Or subcutaneous now, denosumab is available.
I see.
So all these things now are available to make sure
To prevent progression.
to prevent progression.
to prevent
Treatment as well as progression.
In your case, we said, will you say every 50 plus women should get a DEXA scan once a year?
Once a year.
Once a year.
100%.
So we'll add that as well.
Yes.
Sir, does good posture means sitting straight most of the times?
Not necessary. Sitting straight for a long time also can bring a lot of pressure on your discs. Scientific studies have shown that the entire body weight goes on your lower lumbar discs. Disc, as I told you, is a soft, mushy tissue which acts like a shock absorber between the spine
Between the
bones.
vertebrae.
So when your pressures have been measured for people standing, sitting, lying, and they found out that sitting for long can increase the pressure in your disc. So it is necessary for you to stand up, move your body, rotate, and all those things, so that the discs again spring back.
Any time periods, sir, more than 40 minutes, 1 hour?
1 hour, I
1
think.
hour.
Yes.
So sitting in the desk will increase the pressure in the disc.
Yeah.
Every day.
Tagline. And standing and working. A lot of people now they have this laptop stand and work.
Your take on standing desk?
Yeah, that's fine. But only thing is, there also your legs have to be apart. Don't stand straight. They have to be pointing straight. Also, if possible, put a small stool, and you can put one leg on the stool and stand. So that will also release a lot of pressure on the muscles and disc.
So having 1 foot on
the floor and 1 foot
on the stool.
stool.
And then do the standing desk.
Correct.
Perfect.
That's
And
also
then you alternate.
correct.
People will think you're skipping.
No, not so often. Probably 15-20 minutes.
Sitting cross-leg on the floor is good for your knees.
Sitting cross-leg is definitely not bad when you're young. But once arthritis sets in, I would not recommend it, because that will increase the pressure on your knees. Sitting cross-legged, climbing stairs, each time you put weight on the leg, you'll be 5 times your body weight will go on the knee also. So if you reduce 1 kilo, it will definitely reduce 5 kilos weight on your knee. So it's again very important to lose weight for people with arthritis. And sitting cross-legged is not recommended for arthritics.
So just a segue to the next question is, weight loss is the main treatment for arthritis.
It's one of the treatments. I always say that the problems for arthritis, what are the reasons for arthritis, is first age. Second is your kind of work, what you do. Then the weight. And then finally, it is your genetic. It's what your father and mother gifted you.
Sir, if my father has osteoarthritis, am I at an increased risk?
Yes, you are at an increased risk. So there is a chance for you to get arthritis.
I'll come to you.
Hopefully not. You're looking very fit. And you're taking care of your gut also well.
So I need to be really proactive.
You are proactive. You need to strengthen all your muscles on your leg. So the weight also, make sure you don't put on a lot of weight.
Lot of weight, yeah. I was pretty big before, I told you that.
I didn't know that.
I was 100 kilos.
Wow.
5 years ago.
Oh,
Why do you think I'm talking about all this?
It's amazing.
I lost weight by practicing everything.
Yeah.
Then I realized that being a doctor myself, I didn't know where to go, what to do.
Okay.
So then I'm just disseminating information based on what I learned.
Yeah, same here. I'm doing intermittent fasting now.
All right. So using a soft mattress is best for people with back pain.
No. It's totally the opposite. The hard mattress is better for back pain. So what happens is the spine has got nice curvatures. So they are called as lordosis and this thing. So soft mattress, if there is opposite curvature, it will take that opposite curvature also. So you need that mattress to be hard.
Hard.
So scientific research has shown that 70% of people with back pain have shown that they have hard mattresses work well for them. 70%. Other 30% maybe not.
May not.
But
It plays a role.
yes, 70%. Many of my patients also say, Dr. Tarel, when I lie on the ground, I'm definitely much better with back pain.
But the market is pushing towards softer mattresses.
Softer, they have these memory foam, spring, and spring definitely. A lot of people come back to me, spring mattress, I'm having pain. Nothing against spring mattress manufacturers, but people with back pain definitely need a hard mattress.
Hard mattress. So you say, I'm just curious, in your practice, will you ask them, do you have a soft mattress?
I always, all patients, definitely. It's definitely, I ask them, each and every person who complains of back pain, I ask them about their back pain, their work. Any person lifting heavy weights, we tell them not to do that. So these are definite questions as an occupation and their lifestyle we have to ask.
Sir, for back pain, people used to have this small cushion in the lower lumbar area between the chair and the person. Will that help?
See, like I told you, the spine has got nice curvatures. So it's called lordosis. And that lordosis has to be maintained. So this, if your chair doesn't give that, then a cushion can help definitely. Your chair, if it's straight back, then it's better you put a cushion. It's always good to have a cushion.
Super. Wearing high heels can cause back pain.
Yes, it can cause a load of things apart from back pain, foot pain, ankle pain. So what happens when you're wearing high heels? You're being tipped forward. So to do that, you are going to lean back.
Extend.
Yeah, you're going to extend your
the
spine. So your spine muscles are working there. So there you may cause damage to your discs there. So people find it, I don't know whether I can say that, sexy to wear high heels. And
it is sexy, especially in the US.
Yeah, and because they have a nice calf curvature and they can stand straight.
Correct. And also the height.
Height also increases. So, but it has this kind of issues, especially in the back, foot and ankle also. And lot of pressure is going on your great toe. When you're standing on your tip of your toes also. So it's not evenly distributed, the weight of your body.
You have practiced for 20 years, or even more than that. You see these kind of patients more recently?
We do see them more recently. The younger girls coming now with the very active with dance practice and all those things now we do see. And also a lot of ankle ligament injuries because of high heels.
It can damage your ankle joint.
Just slip because of this. They're not very stable on these things, right? Because they have a small pointy toe on the back heel.
So they slip and then they have swelling in the ankle.
Swelling or even fractures.
How long does it take an ankle fracture to heal?
About 3.5 months. And even a ligament tear can take about 3 weeks.
3 weeks. So you recommend not to use that much?
Yeah.
And even if you use it, you need to be very careful.
Be careful when you're doing that.
So that's why they're walking very slowly.
The fear of fall.
Fear of fall. Super sir, one last one.
Sure.
Okay. Running damages the knees.
See, what we call as impact loading. So there is impact definitely for people with normal cartilage, normal knees. I don't mind them running. That is below 40 years. I don't mind them do running or jogging. But after 40, switch over to fast walking, swimming, this kind of aerobic. Elliptical is wonderful. Aerobics kind of things.
So it's I know we cannot generalize, but I'm sorry, I know we cannot individualize, but in general, more than 40 elliptical, less than 40 running might be a reasonable
statement to say. And also in our country, I see these people, young and old, they are addicted to shuttlecock. There are loads and loads of shuttlecock people, sportsmen. And these people, if they don't go in the morning
So play, shuttlecock or badminton cause pain in the knees?
Yes. Pain in the knee, pain in the ankle, elbows, pain in the shoulders. So they can get a tennis elbow, they can get a shoulder rotator cuff tears, and they can have knee arthritis.
You see that often in your practice?
Very often, especially 40 plus individuals. And they say, can I start playing shuttle once the pain goes? I don't recommend shuttle badminton for these people. I would rather say they play something like tennis. Or tennis is a slightly slower game.
Slower game.
And shuttle also, if it's a wooden court, it's much better. So impact loading on the knees is not good at all.
But the shuttle or badminton is getting popular because of the space requirement is much.
It's probably lesser.
It's
Probably now pickleball will pick up.
So you see a lot of patients with shuttle. That's very interesting.
Lots of people with shuttle.
And they come in with what? Knee pain.
Knee pain, tennis elbow, shoulder pain.
And then how do you link shuttle with this?
So I immediately ask them, what did you do to do this? Men usually, women do household chores like washing vessels, clothes and all. They can get tennis elbow. But men, what else do they do?
In the US, maybe.
No, you have machines to do that.
I have machines. But somebody needs to put in the machine. But anyways, it was a wonderful conversation, sir.
Thank you, Dr. Pal. Thanks for having me. It was great talking to you, and I'm sure we'll reach a lot of people through you.
Thank you, sir. It was a pleasure. Thank you so much.
Thank you, Dr. Pal.
That was a wonderful episode. There was a mind-blowing session. Actually, he was surprised that I showed those reels to him. So we learned a lot. I'm sure that you must have learned as well. Small changes. I'm pretty sure you'll be able to incorporate it. But the most importantly, I want you to write that in the comment section as well in terms of what change you're going to do. Because you have listened to this hour-long podcast, I want to make sure that that gets registered in the back of your mind. Okay. So remember, always gut health is the key for each and every other specialty. So take care of your gut. The gut will take care of you. As usual, one belly at a time. It is absolutely important. Stay happy. Stay gutsy. May God bless you.